नाउ अब हम बात कर रहे हैं प्रेजेंस ऑफ अ स्टोन एंड स्टोन देयर इज प्रेजेंट इट प्रेजेंट इन कॉमन बाइल डक्ट. व्हाट इज़ कॉमन बाइल डक्ट? कॉमन बाइल डक्ट में जो हमारी हेपेटिक डक्ट होती है और प्लस सिस्टिक मतलब गॉल ब्लैडर की डक्ट, ये दोनों मिलके कंबाइन करती है, ठीक है, एंड फॉर्म अ कॉमन बाइल डक्ट. तो स्टोन प्रेजेंट है कॉमन बाइल डक्ट में, ठीक है. दैट्स वाई यू कॉल इट्स नॉट्स टू टाइप, प्राइमरी एंड सेकेंडरी. प्राइमरी इट डेवलप डायरेक्टली इन कॉमन बाइल डक्ट, मतलब डायरेक्टली कॉमन बाइल डक्ट में ही ये डेवलप हुआ. सेकेंडरी इट ओरिजिनेट इन गॉल ब्लैडर बट इट माइग्रेट टू कॉमन बाइल डक्ट. So we have a two type of stones, primary and secondary. Maximumly say कि 15% of patient with gall bladder stones, मतलब उन्हें पहले gall bladder stone था, उसके बाद उन्हें स्टोन हुआ कहाँ पर? कॉमन बाइल डक्ट में. ओनली इन 5% केस जहाँ पर डायरेक्ट कॉमन बाइल डक्ट में स्टोन हो गया विदाउट गॉल ब्लैडर स्टोन. ओके, सो अभी हमने देखा there are two types of common bile duct stone, primary, secondary. Primary, it originate in common bile duct, developed directly, and secondary, it origin is gallbladder and then it migrate to common bile duct. If we talk about the stone characteristics, first is cholesterol stone. 60% has a cholesterol stone because obviously bile is made up of cholesterol. So that's why 60% case there is a cholesterol stone. And in 40% cases there is a pigment stones. So 40% is a common bile duct stone is pigment stone. Now goes to etiology. So the reason is there is two. First, infection, and second, I think it's a clinical feature actually. Due to stone formation, the epithelium of the bile duct, there is a duct and duct epithelium. The duct epithelium and there is a stone. So duct epithelium undergo inflammation because of irritation from the stone. This irritation from stone, it undergo inflammation. So there is inflammation and stone formation, and obviously there is obstruction is also caused. If there is obstruction, then bile flow is also impaired. What we observed, bile duct status. So next is pathophysiology. Primary stone which form within a bile duct, and the reason it can be due to prolonged stasis of the bile in the duct or infection. And secondary, obviously it origin gallbladder and it pass through gallbladder duct, is a duct of a gallbladder cystic duct into the common bile duct. Now clinical feature, first is the obstruction. So, obstruction in the juice of a bile juice, and symptoms what we see. So it's pain in upper abdomen and epigastric pain, and the type of pain is colicky in nature. So, what is colicky pain? Colicky pain, it's type of a pain which come in a wave, like sudden pain and then relief, sudden pain and then relief. Such type of pain is called a colicky pain, and it occurs in a upper abdomen epigastric position. Next, If there is an inflammation occur, so inflammation means bacterial infections, itis means inflammation, so it has a fever also come with that, and with fever, chills, and also jaundice. Okay, this is a triad, Charcot triad. So where we observe this triad, this question, it observed because of a stone in common bile duct, due to which inflammation occur. So there is a infection in bile duct due to stone, and if there is an infection, fever and chill. Fever, it's immunosystem response of our body due to infection. Okay, and it can progress to severe causes, which is hypotension and altered mental status, Renault Pentard. This hypotension is just a mimic like a septic shock. Mimic. So there is a hypotension. Septic shock is occurred due to bacteria in bloodstream. So there is an infection occur. So obviously a bacteria is present there. So it can progress to the Renault Pentard, hypotension as well as altered mental status. Third point, obstruction present obviously. So obstructive jaundice and yellow discoloration are present, and it can also in 50% of cases remain asymptomatic. In 10% cases there is acute pancreatitis. Okay. Pancreas is also involved, and infection in pancreas also reach there. Acute pancreatitis, inflammation. Pruritus due to jaundice is common, and stool because lack of bile. When this obstruction occur, so bile not pass into duodenum. Throws sphincter of Oddi. Okay. And due to which the stool is clay colored. Now investigation. There is a infection. So in infection always WBC count increases. So WBC count increases. Infection increase WBC count, and due to obstruction in bile duct. Obstruction in bile duct always elevate ALP, alkaline phosphatase. It's a symbol of obstruction in bile duct. This enzyme has relation with the bile duct, and also gamma glutamyl transpeptide is elevated. Bilirubin also elevated, and which suggests there is an obstruction, complete obstruction due to stone. If there is a complete obstruction due to stone, okay, so is that mean bilirubin is elevated. अगर हम लीवर के एंजाइम की बात करें, AST-ALT इज माइल्ड एलिवेटेड, बिकॉज AST-ALT कब एलिवेट होता है, जब लीवर इन्फेक्ट होता है. लीवर इन्फेक्ट होता है तभी AST-ALT एलिवेट होता है. इन केस ऑफ cirrhosis, ओके, और हेपेटाइटिस, वायरल इन्फेक्शन. Ultrasound to detect the gallbladder stone is there present, or if the common bile duct also can be seen with the help of ultrasound, the dilated common bile duct, which indicate obstruction, because if there is an obstruction in a bile duct, the proximal portion, it becomes little dilated, like that. Okay, so this portion is dilated. It's a dilated common bile duct. On X-ray and CT scan, there is a radio-opaque stone. CT scan, what we show, radio-opaque stone. नेक्स्ट आइडेंटिफिकेशन, नेक्स्ट इन्वेस्टिगेशन हम क्या कर सकते हैं, मैग्नेटिक रेजोनेंस कोलिंजियो पैनक्रियाटोग्राफी MRCP, ताकि हमें डिटेल एनाटॉमी मिल जाए बाइलरी ट्रैक्ट की। नॉन इन्वेसिव है और आइडियल है ये एक्चुअली, क्या, मैग्नेटिक रेजोनेंस, एंड व्हाट्स अ गोल्ड स्टैंडर्ड एक्चुअली, and it can also use for stone removal, which is endoscopic. For endoscopy, we can also remove the stone, common bile duct. So endoscopic retrograde cholangiopancreatography, and they show image also, in which there is an endoscopic retrograde injection of a contrast material lumen of a common bile duct, and it's shown there is obstruction. And with the help of this endoscopy, we used to remove the stone with the help of sphincterectomy and balloons or basket. We use the method sphincterectomy and balloon or basket. Now management, non-surgical option अभी discuss, endoscopic retrograde cholangiopancreatography. It's an initial treatment of choice, and the preferred position is 11 o'clock. Okay, it can be used for diagnostic as well as therapeutic purpose. What's the method we use? Sphincterectomy and balloon or basket. Now next surgical option, which is laparoscopy. It's minimally invasive. Okay, and we can remove the stone easily with the help of laparoscopy. Third is open. Okay, it's open surgical method. It's only done in the case of endoscopic and laparoscopic technique fail. So what we doing? Placement of T-tubes for bile drainage. Now management, obviously there is an infection, so what is management? Antibiotics. And there is a pain management as well as fluid replacement, because jaundice also occur there now, so we have to care also jaundice. Okay, complication, again and again same complication, like infection occur, cholangitis, because of obstruction, epithelial cells irritate due to stone, and what happen? Inflammation, and also infection can be severe, because infection bile duct से, from bile duct it can goes to the blood तक चला जाएगा, and blood में क्या हो जाएगा? सेप्सिस कर देगा, ताकि हमें सेप्सिस के भी सिम्टम्स भी पड़े थे, फीवर, हाइपोटेंशन, अल्टर्ड मेंटल फंक्शन. So it can sepsis and multi-organ dysfunction. Now some mnemonics. First of all, Charcot tried with saying pain in right upper quadrant, its position of a liver, and jaundice because of obstruction. So yellowish skin and sclera, and there is an infection, that's why fever with chills, pyrexia. And if we told about the pentad, then come a hypotension and confusion. It's because of septic shock. Gold standard test, endoscopic dilated common bile duct indicate obstruction which is greater than 8 mm. Most common organism such as E. coli, Klebsiella and bacteroids. What's the management? Obviously endoscopic, it used both diagnostic as well as therapeutic for removal of the stone. If endoscopic fail, we goes to laparoscopy. If laparoscopy is fail, then we need to do open surgery. Supportive care, antibiotics for infection and symptomatic relief.